Hey, Tori, what's up?
I'm glad I could talk to you for a minute. I know you're ready to go to work. My granddaughter is here, and she's got kind of a runny nose. Her mom was running out the door and told me that she had RSV. Can you tell me what that is?
RSV is respiratory syncytial virus. It's a virus a lot like a cold. It starts in her nasal passages and it goes down into the lower airway from those secretions that she's breathing in. Creates a real thick mucus down toward her lungs, and so she has no trouble breathing in, but she has trouble breathing out. Okay? And what happens is when they have trouble breathing out, then that they kind of trap that carbon dioxide in their system. And so their body starts to overcompensate. And they're trying to that workload is harder on them for them to breathe. And so it's a breathing problem that's caused by a virus. It has to run its course. You and I can get RSV. Anybody can get it more than once because there's lots of different strains to it, but you and I are able to deal with it better because our lungs are fully developed. Most babies that are premature are real susceptible to the RSV, and so are those babies that maybe have poor immune systems because their lungs aren't fully developed. And they have trouble compensating for that workload that their body has to do.
Okay, so if it's so much like a cold, how did she know it was RSV?
She probably took her to the doctor maybe for the cold, and once she got to the doctor's office, they were able to do a nasal swab, and that's the diagnostic test for the RSV, and it'll come back positive or negative.
Okay, so the symptoms of RSV is a lot like
Just
cold?
like a cold. Stuffy nose, runny nose, could be earaches, could be tiredness, a slight fever, achies.
Okay, so is it contagious then?
It is, just like flu and colds. It's very contagious. It goes through her respiratory secretions, so if you are going to kiss all over her, and just like grandmas are going to do, it is spread. But as long as you do good hand hygiene and wash your hands and don't share cups and silverware with her, wash her toys, you shouldn't have a problem.
Okay. Well, she didn't have any antibiotics in her bag or anything. Is there anything I should be giving her?
Antibiotics are usually given for bacterial infections, and because it's a virus, I'm not surprised they didn't send an antibiotic with her. They won't send her a nebulizer. Those are usually for other respiratory treatments other than from the RSV. And they don't always work real well with the RSV. The Syncytial shot is sometimes given. That's given for those premature babies or underdeveloped lungs, and that's a winter shot that's given during the winter season on a monthly basis. That Syncytial shot, they can wind up with a reddened spot at the injection site. Can be a little bit fussy from the tenderness around that injection site, but no major side effects. That isn't given for a normal healthy infant. Ribavirin is sometimes prescribed, and that one's given if it is started within the first 3 days. So it would be really effective if she would have got it within those first 3 days, and then it works great. But if not, then that effectiveness is kind of questionable. So it's not always given because kids are at home for maybe a week before they go to the doctor with what they thought was just a cold.
Okay. So how do I care for her then?
Well, you don't have to isolate her. You don't have to worry about anything like that. The hand hygiene is the best thing. You want to just go ahead and keep your hands clean, wash her hands, wash your hands, keep her well hydrated. You want to make sure that she drinks plenty of fluids and keep those secretions thin so she can breathe easier. Sit her up a little bit when you give her bottle. It makes it easier for her to breathe. Hold her upright when you're rocking her instead of down flat. It makes it hard to breathe when you're down flat.
Okay.
And elevate the head of her bed when you put her to bed tonight so that she sleeps at a little bit of an angle. Make her more comfortable to sleep.
She had a bulb syringe in there, and it's been a while since I've done that.
You can suction out her nose and her mouth if you feel like she's really congested, maybe right before you try to give her a bottle. But always start with the mouth first and then the nose because the mouth is cleaner, and then you can rinse it out.
Okay. Okay, so how do I keep it from spreading?
Sure. Spread just like a cold or a flu. So wash off your tables and chairs. The virus itself can live on the surfaces for several hours. So just be sure to spray down everything and wash everything off. Throw her toys in the dishwasher before you go to bed and they're nice and clean.
Oh, that's nice.
And don't, because she puts everything in her mouth right now, just wash all that stuff off.
Okay. So if she takes a turn for the worse in the middle of the night, when do I call the doctor?
Call the doctor with any questions you might have, no matter whether it's poor feeding, if she isn't having wet diapers, if she's extra fussy, of course, if she would spike a fever, if you think she's having any breathing problems, if you start to notice that her breathing pattern changes, don't hesitate to call.